Hi, everybody. Let's see. Welcome. I am Michelle Fay with Voices, and we'll just give it another minute. Yeah, and as Kit's saying, it'd be great if folks could introduce themselves in the chat so we know who we're talking with. Nice to see some familiar faces and some new faces, at least to me, or new names. I think because we do have a lot of speakers and it's a big topic, I will go ahead and get started with some introductory comments. And as people join in, we'll just remind them to introduce themselves in the chat. And there will be hopefully some time for question and answer at the end after our panelists have each had a few minutes to share some wisdom. So everyone, I'm Michelle Fay. I'm Executive Director of Voices for Vermont's Children, and we are serving in kind of a coalition leadership role for the Paid Leave Coalition. And I'm mostly wearing that hat today as sort of the convener of this meeting. And I've invited some, oh, and I should give a shout out to, I'm sitting in the Lieutenant Governor's office. He's let me, there's not a lot of quiet places in the State House, and he let me use it. So yes, please. Yeah, I really appreciate the use of the space. So we appreciate Lieutenant Governor's recommended support. So I'm just going to start by giving you a quick update on where the paid leave bills stand right now and lift up what we consider to be the essential elements of a strong paid leave program. So I think I'll start with that. Actually, our coalition has worked hard to really identify our values and looked to the experience of states that have come before us and have a fair amount of data, which some of our national experts can lift up for us in a minute. But about how to make sure that a program is designed in such a way that the people who most need access to it, who don't have access to any kind of paid leave in their workplaces or self-employed folks, can use it. And that for us, the essential elements include it being universal, which means every employee is in the program. So that's part-time, full-time, seasonal, and with an optional, an opt-in benefit for self-employed folks. It means, strong length of leave. So we're advocating for at least 12 weeks for parental bonding leave, for family caregiving, and for people to heal and recover from their own serious injury or illness. We also are advocating for an inclusive family definition, which we think reflects the needs of today's workforce, job protection, and efficient public administration, because we do know that privatization has been shown to worsen inequities and disparities for marginalized communities. So those are what we consider our essential elements. A very strong bill, H66, was introduced in the House and is nearing the finish line in its first committee of jurisdiction, House General. And after that, it will move to at least 2 other committees, but we're really pleased with the shape of that bill. It is 12 weeks. It's 100% wage replacement. Oh, I forgot that very key essential element, which is strong wage replacement. And so that has been shown to be really important, especially for low wage workers who won't be able to pay their bills if the benefit is only 60% of their weekly wage. So it's 100% wage replacement, capped at the average weekly wage, which right now is about $1,100. And it has an inclusive family definition, 12 weeks. What else am I missing? Public administration. It's got everything. We're happy with it. Obviously, there's always tweaks here and there that can be made, but on the whole, we think it's a very strong bill. There is a companion bill in the Senate, S62, which is largely very similar. There's a couple of aspects of it that are different. The House bill includes 2 weeks of bereavement leave. The Senate bill does not. The House bill has a carve out, which I think has already been taken out. So there was an attempt, and I think there will be continued attempts to ensure that the lowest wage workers are getting kind of the most value for their benefit. And so there was an initial suggestion to carve out or provide a refund for folks who earn $25,000 or less in a year. That turned out to be kind of an administrative nightmare. So there's still some work going on in that department. But anyway, so the process is the House bill needs to go through at least 2 more committees, come to the floor of the House, and then make it over to the Senate by this date called crossover, which I think is March 17th. And we're on track to do so. So with that, I would really like to turn it over to our first speaker, who has to hop off at 12:30. So we want to make sure that she has time. And if any questions come up, any quick questions come up before we move to the next speaker, we can give some time for Vicki to answer. So with that, I will turn it over to Vicki Szabo, who is the Senior Fellow of Paid Leave Policy and Strategy at the Better Life Lab at New America.
Awesome. Well, thank you so much, Michelle. I'm really excited to be here. And I know you and the coalition have been working on trying to move paid leave for a decade or more now over time. So this is long overdue and much needed. So my name is Vicki Szabo. My pronouns are she, her. I'm at the Better Life Lab at New America in Washington, D.C. And have worked at the federal level and with state partners across the country for the last 13 years or so on winning paid leave laws. And we are winning, and that's exciting. And it'll be really exciting to see Vermont join the other states. I am here, I can talk about any number of things, but what I'm really excited to talk about today is the need for paid leave in rural Vermont. And really excited to present a little bit of research that we did here on the need for rural communities to have access to paid leave as a individual and family economic security issue, as a health issue, also for businesses in rural areas to be more competitive, to have a workforce that they're able to attract and retain, to grow their populations, and to help themselves compete with urban areas of the state. So I'm going to share my screen really quickly to just present a areas. And when we're thinking about the intersection between health and paid leave, one of the things that is less discussed but really important is the fact that people in rural areas need to travel further to healthcare services. We've all seen, lots of reports about rural hospital closures. So we dug into specific types of healthcare and healthcare services to look at how rural communities were being underserved or had longer distances to travel. This is important for a paid leave conversation because rural workers are less likely than workers overall to have either paid leave or unpaid leave. Just 28% of workers in New England have paid family leave to care for a child or a seriously ill family member. In Vermont, it's estimated that only around 35% of workers have job protected unpaid leave that's affordable and accessible and doesn't throw them into financial turmoil. So when you're thinking about rural communities that are further from healthcare services, but where workers are less likely to have paid leave, you really have a double whammy where people are forced with very tough choices about whether to get the care they need, whether they can keep their jobs, whether they can care for loved ones. So on the right side of the slide over here are in Vermont distances between rural census tracts and urban census tracts and different kinds of healthcare facilities. Most strikingly, and for those of you who do work with children and with parents and with newborns and work on infant health, NICUs in rural communities in Vermont are nearly 50 miles away from rural census tracts. There's some great data actually about how distances between NICUs and where parents live affects how much time parents are able to spend with their newborns. And there's great literature about how much time parents spend with newborns in the NICU and outcomes. So this is a health issue. This is a parental workforce issue. This is a family stress issue. For pediatric care that's hospital-based, rural folks need to travel more than 30 miles on average. Urban folks need to travel around 13 miles. As you can see, like in general, urban areas are between 12 and 13 miles from hospitals. And for rural communities, even for cancer screenings at a hospital, you've got to travel nearly 20 miles. For cancer treatment, you need to travel on average more than 21 miles, like nearly 21 miles on average. This is the midpoint. So there's, a big bell curve here. Cardiology is 23 miles. If you think about health disparities as well, and you layer that in for communities of color, that's an even bigger issue. And in Vermont, Native Americans in rural areas must travel even further than all other rural Vermonters. So why this matters? When workers have access to paid leave, they're more likely to return to work. This is true for new moms. This is true for cancer patients. Actually, in a study of in Vermont, of rural folks who had cancer diagnoses, when workers have paid leave, they are more likely to stay employed, earn higher wages, get the care that they need, get the treatment that they need, and get back to work. And then in particular, where states are struggling with population aging and not enough babies being born, for rural communities in particular, paid leave can really be an attractant for communities that need to attract younger workers, want to encourage family growth, want to make sure that older people are able to be cared for by the working folks, and those needs are also higher in rural communities nationwide. Paid leave is a competitiveness and economic development policy, as well as a policy for individual families. So I know this is a lot of information, but key takeaways here for rural Vermonters, paid leave has unique value and is a uniquely needed policy, both for individuals and for the community overall. So I will stop there. And if folks have questions about this data, I'll be on until 12:30, and then I'm happy to answer questions by email. I'm just shavo@newamerica.org, and my phone number is on this slide as well, which I believe they'll be getting. So thanks so much for having me. And I will stop sharing my screen somehow. Just a second.
Thank you so much, Vicki. That was just an info-packed few minutes. Amazing. And not all in a good way, right? There's some really troubling data in there.
Yeah.
Yeah. And so with that, we're going to next turn to a community member who has lived through some health situations with either inadequate paid leave or in one case, not enough paid, no paid leave. So I'd love to hear from Amanda Saladino from Barrie.
Hi, I'm Amanda from Saladino. I'm from Barrie, Vermont, born, raised, went to school here. So my experience was my husband and I bought a house back in July of 2020. We had money all saved up. We were both working full-time jobs, benefits, everything was going great. We decided we wanted to start a family. And we did. I found out I was pregnant in October of 2020. And then in December of 2020, my husband got a cancer diagnosis, stage 4. It was absolutely heart-wrenching. We all of a sudden were seeing, the medical bills piling up. We were both working. My husband worked through his cancer treatment because he had to. There was he knew he had access to FMLA, but he did not have paid leave. When I did have my daughter in June of 2021, I did have short-term disability through my employer at the time, but unfortunately it was not quite enough to kind of get us by. Started looking for daycare and everything else. And unfortunately I found a place, but it was so expensive. How much I would have made going back to work would not have paid for the daycare. We would have just been even going deeper. And we had about $7,000 saved up in our savings prior to his cancer diagnosis and everything else. And then we all of a sudden started seeing that savings just dwindle and go away, and we're paying all these things, like we're pulling out of savings to pay for our mortgage. And when my daughter was 4 months old, my husband had like a very high risk surgery in order to remove cancer, and he was out for 3 months from work, no pay. So we had no income coming in for 3 months. And in that 3 months, we, in order to like pay for groceries, which we were on WIC through, so we were getting some benefit from the state, which helped a little, but I'll be perfectly honest, it was not enough. We made do with what we had, but we ended up having about $12,000 in credit card debt, because that was paying for our gas, paying for utilities, paying for our vehicles, groceries, and all of that. And when he was able to go, he was so stressed out about having to go back to work. He had to use his paid time off in order to pay for his health insurance, so that we wouldn't have to pay out of pocket for surgery, cancer treatment, any of, doctor's appointments for myself and my daughter, all of that. And so he had like no time off. He went back to work, like basically as soon as the doctor's like, well, you can, but here's what things that you may expect. And he's been working basically full time since then. And he worked full time through radiation treatment after the surgery. I decided I'm like, I got to go do something. I got to work part-time. I got a job at a local grocery store, working 10 to 20 hours a week, but it's evenings and weekends. So I'm working until 11 o'clock at night, where my daughter wakes up at 6 a.m. And we're just starting to kind of see the debt come back down. But unfortunately, like if we had had any sort of adequate paid leave, the credit card, the savings may have dwindled, but the credit card debt would not have happened. We would have been able to survive on that, 12 weeks of paid leave for my husband, because that's how long he was out. That's when we incurred a lot of the debt. And we're gonna get out of it. We're gonna get through it. But right now it's stressful. And if I had had it after I'd given birth to my daughter, I probably would have been more comfortable taking the time to find an adequate childcare and everything else. And that's not going to just completely burn that hole in my pocket. I think for something like this, if the paid leave would have made an extreme difference for my husband and I. Like, we did all the right things. We saved the money, we had the jobs, we had everything. And then this all happened. And like, obviously, yes, we were planning for the birth of my daughter, all of that. But then it was, the cancer diagnosis that kind of just threw us for a loop. Financially, emotionally, mentally, everything. So, but thank you for listening to my story, and have a great day.
Thanks so much, Amanda. I really appreciate you sharing. It's asking a lot to have you share a very stressful time with everyone. And I just want to note too that when we have asked people to tell their stories, even though yours is a fairly extreme and incredibly difficult situation, many people have come forward with similar stories. Like, I just want to point out that Amanda's situation is obviously extremely difficult, but there's a lot of working families around Vermont who are engaging, are bringing a new child into the world with a ton of economic stress, which has huge impacts on the success of family formation, on maternal mental health, et cetera. So thank you for being willing to lift your story up. And with that, we will turn next to Keegan Alba from Dad Guild to talk to us about why this policy matters for dads and male caregivers.
Awesome. Well, thank you so much for having me here, and thanks for everyone taking the time out of the day to be here. My name is Keegan Alba. I use he, him pronouns, and I am the executive director at Dad Guild. We're a nonprofit organization based out of Burlington that our work is to engage fathers and masculine identifying caregivers in their caregiving roles. And from my personal experience, I was given 3 days off of paid time off after the birth of my first child. Thankfully, I was able to save up a bunch of paid time, like a few weeks of paid time off. So I felt very fortunate. And that also kind of drained my account, which made it really challenging to like take time off for doctor's appointments. And my partner on the flip side had 12 weeks, which, I would argue for more time, but 12 weeks is better than 3 days for sure. And she was able to, be with the child a lot more and just kind of became the primary caregiver in those early days. And I know I was a fortunate person where I've talked to dads and who had to go back to work that next day. And it was like, oh my gosh, like what are we doing? When fathers and non-birthing caregivers are not given adequate time to bond with their children, we're missing out on a golden opportunity to invest in our state's future. The organization I work at, Dad Guild, was founded in 2019 after noticing a community need to better engage fathers and masculine identifying caregivers in their parenting roles. And today, our organization is home to a network of nearly 1,000 dads across the state of Vermont. At our organization, we focus on strengthening relationships between dads and their kids, promoting positive mental health in fathers, and advocating for gender equality. When fathers are engaged in their caregiver roles, kids win. After listening to some testimony from last week, I was reminded that not everyone understands, I think, or is aware of the research out there that shows, hey, there actually is some very legitimate research that shows why it's important for dads to be taking time off after the birth of a child. I'll share some of that research right now, just really quick. Children who feel a closeness to their father are twice as likely as those who do not to enter college or find stable employment after high school, 75% less likely to have a teen birth, 80% less likely to spend time in jail, and half as likely to experience multiple depression symptoms. There are also high levels of father involvement are correlated with higher levels of sociability, confidence, and self-control in children. Children with involved fathers are less likely to act out in school or engage in risky behaviors during adolescence. And children with actively engaged fathers are also 43% more likely to earn A's in school and 33% less likely to repeat a grade than those without engaged dads. Investing in fatherhood sets our kids up for success. When we don't have leave practices where dads are given time, we're really showing, hey, as a society, this is who we believe should be raising children and who should not be raising children, and it's a problem. When fathers are engaged, women also win. According to a Change the Story report from 2019, women are at least 4 times more likely than men to reduce their hours or leave the workforce for a period of time to care for children or aging family members. This means that if a 35-year-old woman earning $41,000 leaves her job until her newborn goes to kindergarten, she could lose an estimated $433,000 in wages, lost raises, and retirement contributions. And that's really set up because we don't have systems to engage dads or make it easy for them to take time off and really prioritize taking care of their children. By default, that falls to mothers and the people who gave birth. Additionally, according to research in the book Good Guys, How Men Can Be Better Allies for Women in the Workforce, women with equal partners at home are more successful at work. In fact, many researchers argue that men's involvement in housework and childcare is the key solution to achieving work-life balance and greater gender equality in the division of domestic roles. By creating opportunities specifically for fathers to become more comfortable and confident in their roles as caregiver, like providing paid leave after the addition of a new child to a family, particularly in those early years, we believe that gender norms and parenting will shift, resulting in a positive impact on women for generations to come. I'd really love to live in a society that invests in fostering the development of healthy relationships between children and their caregivers in those early years. When we don't prioritize fostering the development of bonds between children and their parents in those early stages of life, everybody loses. And I'd really love to shift the perspective that a father taking time off from his paying job to take care of his baby isn't actually fraud. but is actually one of the best investments we could make for ourselves and future generations. Thank you.
Thank you so much. That was a really powerful explanation of how all of our well-being is connected, right? Like we do tend to sort of chop things up when we're working on policy development, but this is an issue that really is cross-cutting. Thanks so much for sharing. Next, we are going to hear from small business owner and parent, Akshita Nayak, who can talk to us about how her experience of, I think, not having paid leave and how that impacted her business foundation. Over to you.
Hi, thank you so much. My name is Akshita Nayak and I own Little Pataka. It's an educational children's brand that offers media products to spark curiosity, celebrate differences, and shatter stereotypes through diverse representation. I've lived in Vermont now for a little over a decade. And during this time, I've started 3 small businesses. And so today I want to share some of my experience as a small business owner and particularly as a sole proprietor. So through the years, I've heard numerous leaders in Washington as well as in Vermont talk about how small businesses are the lifelines of our communities, and that's true. But I feel like our country misses the mark when it comes to policies that truly keep all small business needs in mind. And this is especially true for sole proprietors like me, who normally get left out of the conversations. And we often have no choice but to push ourselves through extremely difficult personal situations because we have no external support to fall back on. Now, a sole proprietor builds a business in a way that it becomes a part of our identity, and our ability to make money is dependent on our ability to show up. We have no safety net when we are hit by a crisis, even though we contribute so much to the economy as well as our communities. Now, during the pandemic, I had to make the gut-wrenching decision to close down one of my businesses, which was a skincare product business, one that I had personally built, product by product, customer by customer, store by store. Because I had multiple health issues stemming from a difficult pregnancy and a few other injuries that I picked up along the way, and that affected production. As a sole proprietor, I had no choice of any type of paid leave that I could take to recover. And closing this business that I had built over 10 years felt like I was letting go of a small part of myself. And I had to it felt like a grieving process for me. Now, over time, I was able to start my new business, which is Little Pataka, but the same concerns continue. What happens if I get sick? How do I make it work when my daughter gets sick at preschool again? We all know what petri dishes, daycares, and preschools can be like. And so what do I do when she gets sick again? How do I make this happen? Now, this new, robust, inclusive legislation that is out there, it includes those of us who are self-employed. And I'm very excited about that because finally we will have access to the same high quality and low cost benefits that employees receive, and we won't be dependent on receiving it from an employer. This policy is going to be a game changer for sole proprietors like me, whose numbers have only increased during the pandemic, like substantially. So we can have an impact here that can last beyond us, and that is really powerful. So I cannot wait to see this across the finish line, and thank you so much for having me here today.
Thank you so much. I know I haven't seen stats to know whether Vermont has a higher than average solopreneur small business ratio, but I know that I think it's 80% of businesses in Vermont aren't even the employees of those businesses aren't even eligible for unpaid for FMLA, and so there really is a need to attend to what the actual workforce looks like in Vermont, which is a lot of small business. So thank you so much. And then last, but certainly not least, we're going to turn to Cassandra Gomez, who is a fountain of wisdom and knowledge about how paid leave programs have been established across the country.
Hi, thanks so much for having me today, Michelle. And yeah, my name is Cassandra Gomez. I'm a senior staff attorney at A Better Balance, which is a national nonprofit that's been working on paid family and medical leave throughout the US for over a decade. And I will spend the next few moments just getting a super brief overview of the key components that build a strong paid family and medical leave program, and noting what the 12 programs that are currently in place do. But as an overall takeaway, I'll just say the Vermont bills that Michelle mentioned at the top of the call are all in a tremendous place with these key points because of all the excellent work that Vermont advocates have been doing. So thank you for that. I'm going to go ahead and share my screen really quickly. Okay, so this first point is about the workers covered by or included within the scope of the law's protections. And best practice, as Michelle was saying earlier, is that universal coverage of including all workers. So all states cover nearly all private sector employees, as well as at least some domestic workers, and all but one state covers employees regardless of their employer's size. And some states cover public sector employees and or allow government workers or employers to opt into coverage. And most states allow self-employed workers, such as independent contractors or freelancers, to opt into coverage. And sorry, I'm just making sure you can see my slides, right? Okay, fantastic. I see head nods. Great. And then this next point about covered purposes. So the best practice is to allow workers to take leave for at least their own serious health needs, bonding with a new child and caring for a seriously ill loved one, as all states do, as well as for addressing the impact of military deployment, which most states do. 4 states also cover certain needs that may arise when workers or their family members are victims of sexual or domestic violence, which is referred to as safe leave. And both of the proposals that Michelle talked about today cover all of these purposes. As far as family definitions go, every paid leave law specifies the family members for whom workers can take leave to care for when the family member has a serious health condition. And best practice, as Michelle noted earlier, is to cover all of a worker's closest loved one, and that's regardless of legal or biological relationship. All states cover at least a worker's parents and spouse. All states but one cover children regardless of age, grandparents and parents-in-law, and almost all states cover domestic partners, siblings, and grandchildren. And in 5 states, workers can also take leave to care for other loved ones to whom they have a close association or a significant personal bond, or where there's an expectation of care. And that's, again, regardless of legal or biological relation. And Vermont's proposals are really exemplary here. For the number of weeks that workers can take leave and receive benefits, best practice, as Michelle said earlier, is to allow for at least 12 weeks for all covered purposes. And all states but one provide at least 12 weeks of benefits for a worker's own serious health needs, and several provide more than that. Most states provide 12 weeks of benefits for bonding and caregiving purposes, as well as deployment-related needs where applicable. And many states also allow workers to combine benefits in instances where the worker has more than one qualifying leave need, so that workers may be able to receive more than a total of 12 weeks of benefits per year. And then this wage replacement rate, that's the percentage of their income that workers receive while they're on leave. And that should, as Michelle was noting earlier, be high enough to ensure that all workers can actually afford to take the leave. In every state, benefits are subject to a cap, and that's typically a percentage of the state's average weekly wage. 8 states use what's called the progressive wage replacement rate, and that's where lower income workers receive a higher percentage of their incomes. And in these programs, the highest wage replacement rate varies from 70% in California to 100% in Oregon, with a sliding scale for higher income workers. And 4 states offer the same wage replacement rate to all workers up to a cap. Again, those proposals that Michelle mentioned earlier are doing a great job on this point. As far as eligibility requirements go, or how covered workers with a need for leave become eligible for the paid family and medical leave benefits, best practice is to set accessible eligibility standards to ensure as many workers as possible are eligible for benefits. So 7 states set eligibility based on minimum earnings, and in some states, income must be earned over a certain period of time. In nearly all states, benefits are also portable, which means that workers can keep their benefits as they move from job to job, or they can combine multiple sources of income, and previously covered workers can access benefits during periods of unemployment. And then just this last point that I wanted to touch on is about employment protections. And so best practice is to ensure that all workers have the right to return to work following leave and will not be punished or fired for taking leave. So these protections can include the right to get your job back following leave, protection against retaliation or interference with leave taking, and the continuation of any health insurance benefits while the worker is on leave. So 6 states give workers the right to return to work following a period of leave, though some of those states do have a short employment duration requirement to qualify. 2 states provide the right to return to work to all workers taking paid family leave under their laws. And most state programs also provide some form of protection against retaliation for workers that exercise their rights under the law. And typically, states that protect a worker's right to return to work also protect their health insurance benefits while they're on leave where applicable. So again, I just want to emphasize that the Vermont proposals are in an excellent place. So thank you so much, and really excited to see how that evolves here. And so I'll go ahead and stop sharing my screen. Thanks.
Thank you, Cassandra. That was really great. And you covered some aspects of the essential elements that I had forgotten. So I appreciate that. We do have a question in the chat about the wage replacement be similar to a short disability income benefit, 60 to 70%. So in terms of what's in the House bill that's currently moving, it is 100% wage replacement up to the average weekly wage, which right now is something like $1,140 or something like that. So if your weekly wage is that or lower, you're actually getting 100% wage replacement. If your wage is over that, so you get up to that amount, and you could potentially, employers can also opt to pay the difference. There's all kinds of options. What this policy does is create a floor under which no employee would fall. Yeah. Are there other questions for any of our panelists? You can either pop them in the chat or raise your hand, or there's a small enough, I think there might be a small enough group you can just unmute too if you want. Yeah, Eileen, hi.
Hi, how you doing?
Good.
I just want to share that on the point of paternity leave, just having been in a human resource administrator role for easily 35 years, even when I was working with employers that had really good policies on paternity leave, there is still a very strong cultural prohibition and taboo about it. And I remember having some conversations with some new dads like, no, you will take this leave. We will cover for you. It's fine. Don't worry about it. But you did get a vibe, mostly from other men, about taking it. So I just want to put out there that there's a strong cultural, still a strong cultural taboo around it. And the other point I haven't heard in the discussion, but I did come in a bit late, is that in my work over the years, adoption is also another time where family leave is strongly needed for both parents. And there are issues around if you're doing an international adoption, that needing to leave and present yourself, or to go to adoption agencies. There is a lot around it that I think that family leave ought to be considering and be specific about.
Thanks, Eileen. Keegan might want to say more about the dad's piece, but I did want to mention that again, in both the Senate and the House bills, leave is covered for adoption and also for foster placements, foster care placements. And so it is very inclusive in that way. Did you want to say anything more, Keegan, or about the dad's part? Not to put you on the spot, but just in case.
Oh no, I was excited. I was like, oh, thank you for bringing this up, Eileen. I really appreciate it. And it's something that that's a big part of the work that we're doing, because like you say, you point out, even when you put the policies in place, that you're still fighting up against years and years of a patriarchal system that is still no, and I've heard stories of men essentially bragging at jobs of I came back to work the next week after the birth of my kid, and you're like, okay, so we have to get the policy part in place, and we have to do a lot of work kind of rewriting the script of what does it mean to be an engaged dad. And so that's our work.
Appreciate that. And wage replacement level actually plays into that as well, right? What we see in places where there is a wage gap, a gender wage gap, there's a disincentive for dads to take the leave if the wage replacement level isn't very strong. So that's another reason we want to hold that line. Laura, I see you've got your hand raised.
Yeah, I was curious. One of the things that we're running into a lot is people that run into bereavement gaps. So you're the caregiver for a parent, your parent dies, you can't just come back to work, and bereavement is a shorter benefit. And I know there's been some movement to include some bereavement period to care for your family members' estate affairs. They're out of state. Is there any movement on that front that you're aware of?
Yeah, so the House bill does stipulate that you can use up to 2 of your 12 weeks for bereavement leave, and it does include for needing to settle estates, attending probate.
Yeah, because that's such a gap right now, for sure.
Yeah, it really is. I will note that the Senate version does not include that. And there was some explanation. There's been very little testimony on that bill yet, but there was a little bit of a conversation in Senate Finance last week where I think it was just a matter of trying to bring the cost down. And I actually didn't mention in my overview that the payment mechanism right now, it's an insurance program paid for by a payroll tax, and the current modeling on the House bill is it's a 0.55% tax, which would be split evenly between employer and employee. It's slightly lower in the Senate because the benefit's a little bit less. So that's the dynamic. I think that's the negotiation that will be ongoing as as the House bill comes over to the Senate, and then there's an attempt to kind of reconcile their two priorities.
Awesome, thank you.
Yeah, Matthew.
Yes, I have a question about this. Does this affect anyone that's on SSI and SSDI? Because that's going to be also federal programs too, with the Social Security and people that are on those benefits already. Does that replace it, or does that help it out? Because some of those, federal benefits, are tied to inflation or a cost adjustment across the state of Vermont, as we know. Is there a way to? How does that affect people that are on SSI or SSDI benefits? Thank you.
Yeah, I don't know that I can answer this with full confidence, but I can say that I know that there isn't, you aren't allowed to double dip. And so if you're on one benefit, you aren't able to partake in another benefit. But I actually don't know enough about SSI and SSDI to know whether somebody might meet the qualifications of having worked in, I see, maybe Laura can help us answer that question.
So just my only benchmark is a short-term disability benefit, which some people have the luxury of dipping into if their employer offers those benefits. But in those cases, you have to report all income types. So your general income, if you're receiving unemployment income, workman's comp income, you have to report it all. And there's a formula that they use. I don't know how this will work, but generally, you're right, you can't double dip.
And eligibility is defined in the proposal. You in 2 out of the last 4 calendar quarters. So in theory, I believe you could be currently on unemployment and then unable to meet the work search requirements of unemployment because of a qualifying medical event or family event, and then apply on paid program, you wouldn't then be receiving benefit. Sorry, I just got kicked off. I don't know what happened, but I'm back. Preston, you have a question?
Yes, hi. I'm Preston. I'm with a national partner called Family Values at Work. And Michelle, you cut out a little bit for me, but I was gonna try to see if I could help with the gentleman's question about SSI, SSDI. And
Yeah.
it can you re-say again what the whether it was work hours or wages earned that makes someone eligible?
It's wages earned in 2 of the last 4 calendar quarters.
Okay. So yeah, my understanding is like if you have SSDI, SSI, and you are still within the substantial gainful activity threshold, you could still take leave if you meet those wages earned. So I guess it just depends on what is the amount earned that you need within the past 2 quarters.
It's not amount earned, it's that you've worked it all in
That you worked it off. Oh,
yeah.
okay.
Yeah, sorry.
Yeah.
Yeah.
That's awesome.
And then
Okay.
and then your benefit is based on the average of the highest 2 quarters, I think. Is that right? Or highest, I can't remember. It's an average.
Okay. That's awesome.
Yeah.
You know, in some of the already existing programs, there's like a wage threshold or a number of hours worked threshold. So it's nice to see that you know someone who is on SSDI doesn't have to worry about that with this kind of bill. I know that only answers part of your question. I think it's a great question and we should learn more about it.
Yeah, for sure. Matthew asked another question about how would it affect Medicare and Medicaid insurance. I mean, the way that it's currently designed, you're not going to have, your income's not going to go up on this program. If it does, it would be just the tiniest bit because of potentially the benefit not being subject to FICA. But in general, it shouldn't, if it's 100% capped, it shouldn't affect your eligibility for other benefits. And anyone want to correct me, feel free to, but okay. Are there any other questions or comments? Great. Well, we will be sending out the link to the recording as well as some resources that our panelists have provided. Want to again give a huge thank you to the panelists for joining us today and for all of you for coming on. Really appreciate your participation, and you can continue to be engaged by following there is a web page on our website, voicesforvtkids.org. If you go to the About Us section, you'll find the coalition webpage, and there's a place to sign on, stay involved, and we'd love to have you on the coalition.
And I just wanted to add, I put in the chat, we have a couple of upcoming, we're going to continue this series. So we have next week, we'll be talking about the child tax credit. And then a few weeks from now, we're going to be having a really great discussion about community doulas. And there's a number that are going to be, we'll be announcing in the next week or so. So I'll follow up and send out the resources, the link to the recording, and certainly also a request for feedback and a survey, and that will include an opportunity to let us know what you're interested in, what you'd like to hear about, so we can incorporate that as we're thinking about topics for future series. We really appreciate your engagement with this and the opportunity to really hear from and listen to you as well. So thank you so much for being here. The other link is also, if you want to stay engaged with Voices, you can join our mailing list. So those are 2 options there. Thank you again all so much, and hopefully we'll see you again.